All right, hello again. Dr. 𝐒𝐻𝐿 here at Mount Dora Family Chiropractic. And in this short video, I just wanted to talk about how does chiropractic care, especially in our office, how does that actually help and what are we doing to help reduce and or correct symptoms of vertigo. So I'm going to turn your attention to these posters over here. But simply put, we're looking at a spine, a neck from the back, and here's the skull, okay? I think it's really important to understand that the human head weighs somewhere between 10 and 14 pounds, and your head is sitting on your atlas, which this would be about actual size, right? And you'll notice, if you can see, there's just two little tiny joints there. They're shaped like a peanut. And there's little articulations that come off the base of the skull, and they sit right in there. So that's it. So your head's kind of like one of those bobble dolls dangling around in these little peanut shaped joints. So traumas, even birth trauma, falling off bicycles as a kid, obviously things like car accidents, even repetitive postural habits from your work or sports, etc., can create and cause a misalignment in here. And they more often than not will go completely missed because they're not going to check it at your medical office, and most chiropractors aren't trained to find it as well. So we're going to be looking for this misalignment. So let's assume we've done all our history, consultation, examination, you've had imaging done, and we found a misalignment. If you have a misalignment, keep in mind, obviously your brain is up in here, and your brain stem, the tail of it's going to drop down inside these top two bones here, okay? Right in this area of the brain stem, in very close proximity to where the head and the neck come together, you have something called a vestibular nucleus. Okay, and that is where all the sensory input is coming from your surroundings, so your brain knows where you are in space, like spatial awareness. All right, so when you're having dizziness or vertigo, it's because your brain isn't determining properly where your body is in space, like there's confusion, right? So it makes you think like the world is spinning or you feel off, and it can be bad, like you're even nauseous and things like that. So there's again, three places you're getting the sensory input. Your eyes, which accounts for about 10% of that input, your inner ears, which is about 20% of that input, and the other remaining 70% of that input is coming from your body up, and primarily that's coming from the spine itself, okay? And then even more accurately, of all that info coming from the spine, 30% of it's coming from right here. So as you can imagine, the most likely place it's going to cause disturbance and mismatch of sensory input is going to be coming from the spine. That's most likely. Okay, so that is where our focus would be. And once we ascertain from your x-ray exactly how is your spine misaligned and exactly how is your anatomy shaped, we can develop and tailor a very specific adjustment to correct that. So in our office, we use something called the Blair technique. It's very gentle. We're not twisting. We're not just grabbing you and twisting and cracking. It's very gentle but very precise to get that to set. So as you can see in the poster here, once you have a misalignment, a lot of things can happen. Spinal cord tension. It can affect venous drainage by compressing your jugular vein. It can affect arterial supply, blood flow to the brain. Decrease in oxygen and nutrients to the brain. That might be important. It can affect your cerebral spinal fluid flow, right? So again, the brain can become actually congested, resulting from that fluid buildup, so you're not flushing the neurological tissues. Brain fog, vertigo, headaches and migraines, things like that can occur. Stress signals going from the brain, so your body can actually go into a fight or flight and be locked into a state of chronic stress. Obviously pain, you know, we've got a bunch of tissues and suboccipital muscles attaching your skull to your spine. So if you're getting that tension and pressure in the back of the head, which might even be giving you headaches as well, all right? And then altered function, just alter your nerve signals between your brain and your body. So that then creates a global health issue, right? Can impact and just lower your overall health potential, all right? So once we do your exam, your history, we have specialized imaging, we'll know exactly what we need to correct and address, and we do it very gently. So if you're not sure or you'd like to get feedback, you can always, check our website, call our office, and even better yet, just read some of the Google reviews, and you'll get a good idea of kind of what's happening here, all right? We do complimentary consultations again, there's no charge. We can sit down and discuss your health issues. We can do some preliminary checks, which would involve checking your posture, We use specialized thermography. There's two barrels here that will roll up the spine, and it'll give us an idea of how the nervous system's performing and if there's stress or imbalance. So we can do those things to begin with, just to even see, are you a good candidate in our office before we go through a full exam, okay? So again, I'm Dr. Todd. We'd love to help you. Please feel free to ring us if you have questions or would like to schedule a consultation. Have a blessed day.